Hi, doctor. It's very nice seeing you after a long time. I mean, actually, we met recently, but it's very long time after I came here for my another procedure.
Yes.
And
Meeting again at our clinic.
Exactly.
Long time. Last time was almost 12, 13
15 years.
15 years.
More than 15 years ago. It was.
So, one thing, your result shows clearly that the hair transplant does not reverse, means the transplanted hair do not fall off after 2 or 3 years. Right?
That's right.
That's what we say. They keep on growing throughout life if they are taken from the safe donor area.
That's right.
Yeah. Great to have you with us again.
Thank you so much. And I have few questions actually.
Yes.
And these are the questions that I normally get from my subscribers. And although I can answer them, but I want you to answer them so that they will understand better.
Yes.
Because it is coming directly from the from the authentic doctor, and in my opinion, you are the best doctor in India.
Thank you.
And also the most affordable when it comes to quality and cost.
Value for money.
Exactly.
Thank you.
One of the regular questions that I get is, after the surgery, do we really need to stay in the same city for a few days? Do we need to meet the doctor for any complexities that we get after the surgery? Is it something like that?
No. After the procedure, like I have been, I think, doing it for 26 years now.
Right.
And patients coming from all the way from Los Angeles also. And never is it a requirement. You do not need to stay here for many days.
Right.
At the most, if your procedure is for 2 days, then 1 day after that, when we remove the bandage and give gentle head wash, that is all that is required. No need to stay for 2 days even.
Okay.
That is all.
Okay. And there is one question, and this is, I would say, even my own concern and question as well. Some people will have thinning of the hair, not like completely clean bald head. So, but they want the hair as well as possible. They don't want to wait for something to work like micro needling or some other. They don't want to try, but they want the hair right away. Maybe because they got some marriage schedule. They don't want to be bald at least for a few months. So, if we transplant hair on that person, is it like it is going to damage more of his own hair, or is it okay to do transplantation for the thinning part of the hair?
Right. Thank you. That's something which a lot of people are asking nowadays.
Right.
See, it is a gradient. Like if you have lost up to 40% or 50% hair, then I will not advise you to put any more hair in between those hair. There is chance of damage. But if you have lost something like 70%, means the area has hair, but it's very thin, then we can definitely transplant. So what happens is, in areas which are at least 70% thin, we will notice some very well-defined spots. So we can fill all of them.
Okay.
Just one thing which one has to remember. See, those are thinning hair. Means every time with each cycle they'll grow to a length which is usually much shorter than before, and then they'll again fall down.
Okay.
So in a transplant, when we trim those hair, which are in their, some of those may be in their final cycle. After that cycle they may not be coming back.
Okay.
So you cut those hair and then you put the hair in between them. Then that hair will not be lost because of the transplant, but in its normal cycle. Similarly, when we put grafts in an area which is thinning, remember those thinning hair are also growing slow.
Okay.
So when we cut all of them, put the grafts in between, then it is not that they'll grow back very fast. They'll also take their time. If your normal hair is growing back in, let's say, 1 month, they may take 2 to 3 months. But they will grow back. So all these things is something which confuse people sometimes. They think maybe putting the graft has led to this. No, it is the normal cycles which are going.
Right.
Whenever as a doctor I can find any empty spaces where I feel that yes, if I put grafts, it can help the patient without damaging the hair, I do that.
Okay.
But again, I explain these things to avoid any confusions.
Right. Okay. Got it.
So we can put but you have to be careful.
Okay, got it. And again, another question. This is also my question only. So I came here with lots of questions in my mind. So, for example, I have a decent thickness in my fat wherever the hair transplantation is done, and I have see-through look and thinning in the crown area. Now I want to fill this crown area. Then, in case if I am too greedy, and if you want to thicken more, and I know that I have very less crown area, but still if I want to have little thickness in the middle somewhere here, how can we do that if the donor from the hair is very less?
Then we will use your beard hair. That is one of the strongest hair which we can use apart from the scalp donor hair.
Okay.
And even in the scalp donor hair, I would like to point out this thing, that only this part is permanent, not the one above it, right? So this is a small quantity. So when we need more donor, then beard is the next best donor. So if we need to thicken up any place in between, we can always use beard grafts.
Okay.
We'll do so in your case if required.
Right. And I have one strange question. I don't think anyone has ever asked me this question. And this is again my own question. I have these things in my mind. I just want to get these things clarified. So normally what we do, the single hair transplantation will be done on the hair. And how it will look, I don't know. I'm just asking this because I want to know the answer. How it will look if we transplant some body hair in the hairline, which is very thin. Maybe we will take it from some other chest area, some other area. Will it look more natural if we include hair from the back, also from the donor in the hairline?
See, for many years I have been doing this particular thing, which I normally say is, in terms of art, it is the fine limit of art. Why? Because we put around 20 to 25 fine hair in the hairline. Those are hairs which I can get from the chest if your chest hair is straight, or sometimes from the nape area in the neck.
Okay.
Again, those are thinner hair. We want hair which is thinner and shorter than the normal hair, because that is how hair sometimes grow in nature. If you see in a young person, he'll pull his hair back and you see some fine hair.
Right, exactly.
So for that fine hair, it's not a lot of grafts. It's somewhere between 20 to maximum 50. And we can put it in the front row mixed with your own hair, scalp hair. So that gives a feathering effect, which is much better than just doing zigzag.
And those thin hairs will be body hairs?
Yeah, body hair.
Okay,
Those will be either body hair or nape hair. These are two categories.
Okay.
So it will also depend on person to person.
Right.
Like if you have a very curly hair in the chest, then I will not use it. You don't want a curl hair.
Right, okay.
It should be matching your head hair.
Okay, so this is actually already in practice, like
More than 10 years.
Okay.
But this is something which is not very talked about.
Okay.
But yes, we have been doing it. It's really nice.
Okay, so can I have that now?
Sure.
Because right now, what I know that this feathered hairline is actually from my scalp hair.
Yes.
So some hair maybe as I said here.
Agreed. Scalp hair, especially the central scalp hair, is the thickest hair from the scalp donor area.
Okay.
And now when we are putting it in the hairline, then I agree that yes, it can give a very strong appearance.
Yeah,
So,
very natural appearance.
Yeah, natural, but still a strong.
Yeah, strong, right.
Yeah. So if we want, we can just add some chest hair, if, like yours seems to be just fine.
Right.
We can add, let's say 50 or so of them to the front two rows. We'll not bring it down, we'll just add them there.
Right.
So it looks thicker.
Right.
When
From strong to natural.
Yes.
Right. Okay.
And when I am putting those there, remember I will be putting it around your previously transplanted hair.
Okay.
And it will not be damaged.
The existing hair won't be damaged.
No.
Okay.
There is a reason behind this. So this density is good, but I am still putting in between, because see, in nature, when the hair root goes inside, when the hair root is inside, it's splayed like this. No, it's spread apart.
Right.
But imagine when it is a transplanted graft. In the transplanted graft, you made a slit like this, and the graft is going in just these two dimensions.
Oh.
So when I'm making a slit just adjacent to it, there is virtually 0% chance of damage.
Okay, got it.
That is also something which we have been thinking about 10, 15, 20 years. That is all we are.
Okay. I mean, this is a question that I have it in my mind for a long time, and I wanted to get this clarified. And now I think it is not only clarified. I think I'm going to get it done on myself.
Definitely.
That is really, really good, actually. And one more stage question. So, someone has very less donor area in the scalp donor area, and the body hair is also very thin. It's not like he got zero body hair, but it's very thin.
Very thin.
The question is, can we? I mean, not in the hairline, but some on other parts. Can we do a dense pack with those thin hairs? Because those thin hairs are too many, and at the end of the day, the count would be too much. It could be 20,000 grams. Yeah.
And,
but the person is not going to. He's not planning for long thick hair. But he may cut it. He will go for buzz cut. But his head will be full of hair.
I'll show you two cases. Right? You can showcase them in the video.
Okay.
So one of them is a person who had very fine hair in the body,
Okay.
and he had no head hair. Okay, that is a landmark case.
Right.
And we did it all over his head. Yes, it will take lots and lots of graft when we are using those thin hair.
Right.
And you'll also have to remember that those hair will be growing at a much slower pace, very slow speed. It's not that you just cut it and you then imagine it will grow back in 1 month.
Right. It is just like body hair. Okay.
Yeah, it will grow much slower, but it will be there. It will give a good effect. So that case shows this thing, that how without using any beard hair also, without using any head hair also, we can get a sort of filler effect.
Okay.
It will not be a strong wall of hair, but a filler effect.
You have a couple of patients.
Yes.
I'm really interested to look at those cases actually.
Then there is another case. In fact, that case is the world's first published case. In the Indian Journal of Dermatology, it was published, where only body hair were transplanted on a totally bald Norwood 6 patient.
Oh, okay.
Okay, that was the time when body hair transplant, you can say, was validated.
Okay.
It was discovered before that, invented before that.
Right.
So he goes by the name of Top Shiny, nickname of Top Shiny. I'll show his pictures. So his entire head from here to here is mostly chest and body hair.
Okay.
And the first case when we published, it was just this place. These were all chest hair. So you can see for yourself how nice. But in his case, the chest hair were of course very strong.
Okay, got it.
Means it was this long and strong.
Okay.
But still it was body hair.
Total body hair.
Total body hair.
And how was his hairstyle? I mean, he's always.
You see, he's roaming around Vienna and Austria with hair combed back, and he sent me pictures. Seriously, and he was very happy. And that was almost 10 to 12 years after his procedure.
Wow, that's
And
great.
last year he came back to us
Okay.
with his son.
Oh, okay.
And now he wants to get it done.
His son wants to get it.
Yeah.
Oh, okay.
So now when he had already seen in his father's case there was nothing, he also went for a lot of body hair.
Oh, okay.
So that is what I say, where the proof is there.
Right.
So it is possible. And definitely, as long as the patient remembers that, okay, it's not head hair or beard hair, it is not with that much coverage.
Right.
It is still a very good additional hair. We cannot use chest hair instead of head hair or beard hair. We can use them in addition to them to make it fuller.
Right, got it.
Like I always tell my patients when they ask me, how many grafts do I need? So sometimes I think they are waiting for me to tell a small number. Then I'll tell, okay, if you are this bald, right? And God comes in front of you and says, okay, do you want few hair or do you want lots of hair? But you still say that you want few hair. If you are going for a transplant, go for a full head. Why do you want to keep your hair on your beard and keep your head empty, or have a long hair on chest and nothing on head?
Exactly.
It's always the
And
numbers.
I don't think there's any use of this body.
No use.
Yeah. We are not roaming in the, with the boots without any glasses, and we don't need protection from that thing. And another question actually. So for example,
And in fact, with these body hair, that is when we can actually reach those magic numbers. Like some people even have very less beard also. So for them, body hair is the only
is the
option.
only option.
So if it is strong, then definitely.
Right. And one question, like for example, if you, I mean, is it like when you actually transplant, those thin hairs, not the scalp hairs, but from the lower part of this area,
Neck,
the body hair in the hairline. Do you have to first ask the patient to, because the graft one would be more, but he may not understand the value of it. So,
see, that is one thing why I say my patients are always happy.
Okay.
It's because I don't treat them like children. I'll discuss the case thoroughly with you. If I'm going to use any hair from your body, which is thinner, I'm definitely going to ask you 2 times, 3 times. See, I'm going to put this. Are you okay? I'll tell you the pros and cons, both of it.
Right.
I can't just tell you, okay, I'll lie down, I'll put whatever I want.
Right.
Similarly, when a person is going for a hairline also, I find a lot of time people say, just give me a normal natural hairline. I tell them, no, demand. Ask your doctor, I want to discuss which hair will be put in which place, where I want my hairline. Do I want my hairline like this, whatever. So without discussing, there is no point in putting someone's hair.
Right. That's right.
So we'll always discuss, make a plan, how many grafts, which area, then accordingly.
And one more question. This will see.
Yeah.
This is not not something that I know, and I'm just asking you a question. These are I'm getting these things cleared actually. Like I mean, I have these questions in my mind for a long time, and I'm really getting the answers right now. So if someone has a beard and less body hair, and he also has less scalp hair, and he says that no, I don't want beard, put everything on my head. Will you take out more beard hair from the person?
There are 2 things. One is guidelines for body hair transplant.
Oh, okay.
That I formulated a long time back. But what I say in that, it is based on my patient observations. See, in the front rows, we put only head hair with very few fine hair if a person really wants. Then we don't put beard hair in this area, right? And then as we go back, we mix them with your head hair. We go in that way. But we can't do that, okay, put only beard hair in this area and no head hair, because that will look odd. Similarly, there are a lot of doctors, I keep on hearing them telling patients that we'll first use your head hair and then we'll put your beard hair.
Okay.
See, if a person speaks like that, I would run away.
Right.
Because I think that person does not have any sense of art. Because imagine the beard is so strong, and if you have beard going like this and head hair going like this, it will look odd.
They won't match at all.
Similarly, you don't want a mohawk. You don't want that these hair are very thin and suddenly all beard hair are going like this.
Right, exactly.
So we can use beard hair, but never use it alone.
Okay, got it. It has to be mixed with.
It should be always mixed with the hair.
Okay. And the other question is again, still it is there.
Yeah.
Like if maybe you would be.
I'll use a lot more beard hair.
Yeah. I mean, your patient says use more beard hair. I mean, mix it with the existing scalp hair, but use more beard hair. Then you take more.
We can do up to 60% beard hair in a particular area. Even in some patients whose beard is not very curly, we can go to 75% also.
Okay, that's nice. Okay. Nice, doctor. I think as of now, I have only these questions, and thank you so much.
There are few things which I want to tell to your
Sure.
viewers also.
Mhm.
Take care of your hair very, very much.
Mhm.
That is why I brought the gene therapy of hair loss also. Remember, this is first generation gene therapy for hair loss.
Right.
Because in a few years, maybe maximum 5, you will be having the advanced gene therapies and peptide therapy where you will be just getting an injection or a spray in the nose,
Mhm.
and then your hair would be good and healthy for next 5 to 10 years.
Okay.
The only limiting factor will be you have to save your thinning hair till that time.
Okay.
If there are thin hair, we can make them strong. Just like in this gene therapy also.
Right.
In this gene therapy, the only thing is the patient has to do some work at his own end.
Right. And the grafts, I mean, it must be alive at
Yeah.
least by the time we
So
start.
save your hair
Mm.
for that much time,
Right.
because it is a wonderful time which is going to come.
Right.
And read about this also. It's coming.
No, no. What is your expectation? Like, within how many years do you think?
5 years.
Within 5 years.
Yes.
So if someone can save their hair for next 5 years, they will be saving for the whole life.
Yeah, most likely.
Okay, that's nice actually. That's nice. And also I think.
And when we are saving also, no, we are not using any harmful medicines like finasteride. We are using very targeted supplements and just making your stem cells strong. It is the stem cells which weaken and which ultimately lead to loss of those hair. So our target is the stem cell of the hair follicle. So once you make them strong, then the hair is not going to go away.
Okay.
Right?
And I have one more question actually. This is a question I get from many subscribers. The simple question is, what are the side effects of finasteride? That's normally the question that people ask, but I will put it in a different way, because I used finasteride for almost 13 years, 12 years. When I had my previous surgery with you, I started finasteride and I used it till my 42nd year. That means it's just 3 or 4 years I stopped it. And the reason why I stopped it, because I observed, I will tell the side effect as well. My libido went down, but my libido went down after I reached 42 years of age. Until then, I did not face any side effect, but I got very good result. My hair was not thinning. My hair was there. I mean, whatever my natural hair was there, it was it was there, very thick and strong. And when I observed that finasteride is giving me the side effect, I stopped using it. Then my hair started thinning. Then I realized that it is the finasteride which saved my hair. Now, what is this? I mean, like, can we battle with the side effects, or can we do something about side effects and still we use it, or we should not be using finasteride at all?
See, I normally tell, if you, as a patient, you have the right to decide whether you want to use finasteride or not. But my duty is to tell my patients what are the possible side effects. Sometimes those side effects are not highlighted by the company. So that is the problem in case of finasteride. There are 45 countries in which the governments of those countries have told the people making Propecia or finasteride that they have to mention a warning that this can lead to suicidal tendencies.
Oh.
That is the one thing important.
Oh my God.
How do you decide? He may be deciding to go and end his life, not knowing that it is just because of that tablet. He can get chronic depression. He will not even know that it is because of that tablet. So those things I have to tell. And you can read about this on post-finasteride syndrome. That is a foundation, a worldwide foundation they have made.
Yeah.
All the people who suffered from the side effects.
Right. And actually, I have gone through that thing, this post-finasteride syndrome, and one of the side effect is small size penis.
Yeah.
I mean, I was a little scared actually that it didn't happen to me, but I mean,
It's a scary thing.
Yeah, but is it something that people?
Yes, I meet some patients, like young people also. And it's really sad because someone put them on finasteride without telling them the side effects, and then they have come like important for the last 10 years.
Oh God.
So there are people who actually cry that if we knew, then we would have stopped.
Oh, no.
So that is a big thing. And second, another thing, remember, I told you about gene therapy. Similarly, understand that when we are giving these medicines, we do not know most of the time how they are working, right? And these medicines will, of course, because we do not know the mechanism of action, so we do not know the other harmful effects they are doing. It's not that it just goes and blocks the DHT. There is more to it than that. Like when we are talking of this, we have to focus on the stem cells, on those amino acids and the enzymes. What are they doing to the genes of the hair follicle? Are they protecting them? Are they doing? Once we know the correct route, every path, then it is easy to say whether you take this medicine or you don't take this medicine. But that is for future. For right now, I say that if you, a lot of doctors are now putting them on finasteride. So why are they doing it? Earlier they didn't used to put every person on finasteride. One of the reasons they are doing is because they are taking hair from the non-permanent donor area. So you'll find only in many places on social media, not just here, they are taking hair even from this part.
Right.
So now that part is a part which may be lost. So if you don't want the patient to know this, you put it on finasteride. That okay, maybe we'll be able to stop his hair from there also.
So they're
So
actually
there are many
saying,
things at play.
okay, they're actually covering up their botched job actually.
Yes.
Okay.
And they can't take out from the beard, from the cheeks. So what they do is, a patient needs more, they go up.
Okay.
Or if they couldn't take out from here, you'll find many people, they leave this part untouched when this is the safest, best hair.
Right.
Because this is more difficult to take out.
Oh, okay.
There is no bone under this.
Okay.
This is bone, so they go after the easy hair.
Okay.
Right? So that's also why they keep on telling patients you must take finasteride. Otherwise, it's not really that. Secondly, if a doctor tells you that okay, take finasteride, it will save your remaining hair, then my advice is take finasteride for 6 months.
Okay.
See whether it is saving your remaining hair. It doesn't save in every person.
Right.
Because if you are basing your entire plan on a hope that maybe later on finasteride will help me, right now I'm going for a transplant, then that is not a correct way to do. No? So if in 6 months you come to know whether it is benefiting you, whether it is giving you side effects, and then you plan accordingly.
In my case, different finasteride worked, but it different. I'm very much sure about
See.
it. But at the same time, it gave me side effects as well when I crossed a certain age.
It definitely will work for some people, then only it will be approved.
Exactly.
Otherwise, why would they be selling the medicine?
That's
no?
exactly it. Yeah.
But then we have to see we have to calculate everything. No?
Exactly.
So I say, why not give that right to the patient? It's not as if you are having a heart attack or going to die that I say, no, you just have to take this.
Right.
This is some place where you can take your own decision. I will not force a patient to leave finasteride also. I'll just tell him, okay, if it is suiting you, then you take it. If you want, right?
What I analyzed about finasteride is until and unless, I mean, till the time our testosterone is good, our estrogen levels are good, if our DHT is slightly high, then if you are taking finasteride, it works very well. But if there is some hormonal imbalance, like if our estrogen is going up and if our testosterone is going down, especially it happens after 40s, at that time finasteride is going to give a lot more side effects.
Yes.
That's what I mean. Existing
It's
whatever.
logical, no?
Exactly.
Because it was maybe blocking 3 out of 4, and now only 3 are remaining. Then it's blocked everything.
Everything. That's exactly.
Yeah, that is logical.
This is what I experienced practically, and when I stopped finasteride, everything come back normal and all my hormonal balance. I got my hormones in balance and all the energy got back. My libido got
So
back.
now everything is good.
Yeah.
So like I say, in medicine, common sense is also very important,
Exactly.
and it is not only the doctor who has to do it. Use your own sense also,
Exactly.
and it will actually work.
Exactly.
Yeah. And definitely use the derma roller and resveratrol.
Sure.
Now it's a new thing, but it is showing very good results.
That's correct, yeah. And I'm going to explain my subscribers as well,
Yeah.
because I have not started dermatology until now, but after the surgery, after a few days, I'm going to start this.
I'll teach you also how to do. So patients who are in Hyderabad or South, they can actually sometimes they find it difficult coming all the way to me for
Right.
just getting a demo of gene therapy.
I can guide
I'm
them.
sure they'll be able to contact you and seek your guidance.
Sure.
Right?
Definitely. Okay, doctor, that's it. Thanks a lot. Thanks for answering lots of questions, and I'm pretty much sure this video is going to be very, very helpful for many subscribers, many people who are suffering with hair loss and are curious about hair transplantation and have these questions in their mind. Thank you so much, doctor.
Definitely good.
Right.
And remember, in most people, we can get 8,000 to 12,000 grafts.
Okay.
That is something I want to impress on people. Because with the
8,000 to
modern,
12,000 from scratch?
in an average Indian,
Okay.
you can get that much grafts from the head and from the beard.
Okay.
Not just from the head.
That's okay.
Yeah,
Okay.
that much. Because if you don't know the numbers, if you know that yes, you have the 8,000 grafts which you can get taken out,
Right.
and you are putting only 4,000, then that is a disservice. 4,000 grafts for a full-born person was something 15 years ago it was the norm.
Right.
You also remember that.
Exactly. Exactly.
Not now. Now we have progressed, so why should people be left half-walled?
That's that.
When we have the donor, we should be able to.
Those days, I believe if someone has about 5,000 grafts,
It used to be-
it's a miracle.
Nowadays, 5,000 is commonplace.
Right.
Nice seeing your result in person again.
Sure. Thank you. And I think we can go ahead with my assistant.